Welcome, ladies. Today we're talking diagnosis and your checkup list. It's very important for us to understand what our bodies are going through before we start acting on diet and lifestyle, before we're thinking about supplementation and even about treatments. We are going to start today by talking lab tests and how important they are. Sadly, there is no blood test to diagnose perimenopause. It's never going to be the case that we go to a doctor and we get a piece of paper saying, there you go, you're going through perimenopause. Sadly, it's not as easy. Perimenopause diagnosis is more based on your symptoms and your history. And that's when it's very important for you to have a good doctor, a good practitioner that take the time to listen to you. In saying that, tests really helps. There's some very important things that we can get out of blood tests. The first one is to rule out any other possible conditions that could be causing symptoms that are very similar to those that we expect to go through when we're going through perimenopause. So for example, we might have there somewhere a lady who is 47 years old and she's really struggling with fatigue, with weight gain, and because of her age and because everyone around her is talking about going through perimenopause, she assumes she's going through perimenopause and she doesn't do anything about it. Well, first of all, this is not the right approach regardless, but it might be that she might be experiencing a thyroid dysfunction, for example, and she's missing out on the opportunity to address the thyroid issue just because she thinks that she's going through perimenopause. I mean, even if she was going through perimenopause, there's a lot of things that can be done. But hey, she has a thyroid dysfunction. And maybe if she addresses that thyroid dysfunction, she's going to get on top of everything and she's going to realize that, hold on, no, I'm not going through perimenopause. Or if I was, this is not a symptom that I'm experiencing because of perimenopause. It was something else. So it's very important for us to rule out. There's a lot of conditions that can overlap and have the same effect in our bodies. And those conditions, of course, even if you're going through perimenopause, they for sure are going to make things worse. So they need to be addressed. Now, the second reason why we love doing blood tests is to get a baseline marker for future comparison. That's when we start spotting trends. So let's say, for example, if last year you got your insulin tests done and this year you got it done and the next year you get it done, and then you start realizing, hold on, this number is rising every year. Even though I haven't changed anything in my diet or lifestyle, this is a trend that needs to be spotted and needs to be addressed before it becomes a bigger issue. And that brings me to the third reason why we want to do tests, is to spot those early red flags before they blow up. The best thing that we can do when we're talking about health is prevent. Prevention is much better than chasing a cure, chasing a treatment, isn't it? And if there is disease development, picking up those patterns early in the beginning, it's much better than waiting until things are out of control. So this is 3 very good reasons why we should stay on top of our regular checkups. With symptoms and history in hand, we rule out any possible conditions, or we pick up and address any possible conditions, and then we monitor and then we plan. It's like having a little roadmap to guide us in our journey. It's important to remind you as well that as we age, our body doesn't absorb and doesn't synthesize nutrients, vitamins and minerals as it used to before. So it is normal for us to see deficiencies happening even though we haven't changed the way we eat or the way we get sun exposure, for example. We're still getting the sun, but all of a sudden our vitamin D is going down and we don't understand why. It's part of aging, our stomach acid changes, our gut bacteria changes, and then we start seeing a decline on those guys. Now, those vitamins and minerals, and this list is not exhaustive, there's more to it. Generally, we're going to see deficiencies that start affecting those very common symptoms that affect us in perimenopause. So they can be the cause, or they could be aggravating those symptoms. So when we're talking irregular cycles, hot flushes, night sweats, sleep problems, mood changes, fatigue, brain fog, weight changes, cravings, digestive issues, that could be coming from another place as well. And that's why it's so important to stay on top of it. All right, so let's start with our essential blood work, which is going to be very easy to get from your GP. Anytime you go to see a GP with complaints, with symptoms related to perimenopause, or even if you go just to do a checkup, it's pretty much guaranteed that you're going to get a full blood count. You're going to get your lipids profile checked, most likely your vitamin D, your folate, liver and kidney function. This is pretty standard. Then there's going to be a series of bloods that can be done on a superficial level and on a deeper level. And that's very important. This is when we step in and we start advocating for ourselves. Because there's a difference, for example, between an iron test, a serum iron test, and iron studies. And I'm going to explain why, because you need to know those things. When we test just iron, serum iron is the iron that is available in your bloodstream. So let's say, for example, the night before you got your bloods collected, you went out to a Brazilian barbecue or an Argentinian steakhouse, or you took a supplement that contained iron. Your body is pumping with iron. It doesn't necessarily show us if your body is able to utilize the iron or not. It's not showing if your body is going to be able to absorb the iron and use in the future. So if you just test iron, you're just testing the surface. It's like if we're talking about an iceberg, you're just checking what's above the water. Now, below the water, we have ferritin, which is your storage of iron. That's when that's where your body goes to grab some iron from when you didn't eat that steak or when you didn't take that supplement. How important it is to know that our iron stores are full. And how important it is to know if we have transferrin, which is a little protein that goes into that storage. It's like if it was a little Uber. It gets there, it gets a whole lot of iron molecules in it, and then it goes out distributing that iron in your body. I mean, you can have great stores of ferritin, but if you don't have transferrin, your body's not using it. You see how things start changing. And the reason why I'm teaching you that today is because from now on, you have to advocate for yourself. You need to know, especially if you're tired, if you're fatigued, you're losing a lot of blood because you're getting heavier periods, or maybe because you stop eating animal products and you're feeling really low. You go to the doctor and you check just your iron levels. That result alone can be deceiving. So we need iron studies. TSH is a marker for thyroid function, which again is just the tip of the iceberg. And it's a different test to the thyroid panel, which is going to test TSH. It's going to go below the water and check what's below the iceberg, your free T3, your free T4. And if needed, if you have concerns about your thyroid health, or if you have family history of autoimmune disease, you can check your thyroid antibodies and reverse T3 if you need. And even getting a thyroid ultrasound, because there could be nodules, there could be inflammation that is going to be picked up on an ultrasound. So once again, the difference between testing just the top of the iceberg or the whole picture. Because believe me, there is times in which your body is so good in regulating, trying to keep up with all the mess or the damage that's going on in your body, the TSH is looking really good because it's working really hard when below the surface there's a whole lot of mess that is just trying to fix. And if you pick up that mess, you don't get to the point when your TSH is out of whack. You're actually supporting your thyroid instead of waiting for bad results. Same thing with glucose levels. I mean, testing glucose levels on its own, it's not very useful. We need to get your insulin tested. We need to calculate your HOMA-IR. We need to get the HbA1c, which is a 3-month glucose control. It's just a blood test and shows us a bigger picture. And we need to watch the insulin trend as well that I mentioned before. Observe if there is an increase in insulin along the years, because it's not until insulin is out of whack that we're going to see the glucose out of whack. So getting just the glucose test is not good anymore. It's not enough anymore. Vitamin B12, there's two types of vitamin B12 that can be tested. The vitamin B12 that is in your body, or the one that is activated. So getting your active B12 is better than getting your B12 alone. And there are also specialized markers that go a bit deeper, and it's not going to be on that normal checkup unless you ask, or unless you have a very good professional that takes their time to listen to you. Okay, hormones, it's a fairly good one. We get that asked often, but we also want to get our testosterone, the total and free. We want to get this guy here, the SHBG, which binds to testosterone. We want to understand what's happening with our DHEAs. If it's relevant to you, depending on where you are in your life, if you still want to get pregnant, getting your ovary reserve count. Depending on the context, if needed, get your cortisol levels checked as well, considering always that cortisol changes quite a lot throughout the day, and you might want to get your prolactin as well if you're having cycle irregularities, just to exclude pituitary concerns. All right? Then we have our inflammation markers, CRP, ESR. If your lipids are out of range, or if you have family history, depending on your age, you want to get your ApoB count done as well. Your calcium score, which is not covered by Medicare. It's a scan that looks for cholesterol particles in your arteries. So those are things that are not part of your regular checkup. Calcium score, has to be, it's an out-of-pocket expense, but it's peace of mind. If you have that picture, if you have a family history, and depending on your age, it's definitely worth doing it. Now, let's have a look on this request form that we often get from our doctor. I'm pretty sure you're familiar with it. You must have got at least one of these in your lifetime. Note here that you have your list of tests requested in this area here. It's usually typed by the doctor. So this is where you're going to look at before you leave the doctor's practice to identify what kind of tests that your doctor is actually asking from you. If the doctor just asks for a full blood test, well, it's not enough. Look at so many other tests. I'm not saying that a doctor will ask and will have to ask all these tests here from you. Quite the opposite. Depending on your situation, there's no need for it. Fair enough. But for example, if you have thyroid concerns, having your TSH or your thyroid panel done, it's going to make a whole lot of difference. If you're fatigued, you're going to look into the form and you're going to see, oh, hold on, you just asked for serum iron. Can I have a full iron studies? And that's okay to ask, because you're just wanting to go a bit deeper. Now, we don't need to get to a doctor and ask all these bloods. We need to consider the context, but it's very important for you to read that list before you leave the doctor's office, because you might want to order one or two tests. If you're fatigued, for example, and the doctor only asks for iron, you might want to check your vitamin D and your vitamin B12 as well, for example. Yeah, and there's another field here in this form that it's copy reports to. If you are seeing another professional, get your doctor to share a report with your other professional as well. It's very important that all your team, the team that is looking after you, have access to all your results. And always get it printed. When you go into the doctor to get the results, or even if you get the results over the phone, ask them to send it via email, or if you are in person, print it to you. And we're going to discuss why later. It's important to consider the context as well. For example, if you're taking the pill, your hormonal bloods is going to be misleading because it doesn't tell a whole story. It doesn't tell the full picture. It's being shaped by the fact that you are taking a hormonal pill every day. And knowing the day of the cycle in which you are in when you collect your bloods is very important as well, because as I show you here in this picture, we have a huge fluctuation of hormones happening in our body throughout our cycle. So for example, here in this result, we have estradiol at just over 1,000, which is absolutely fine if you are on these two phases here. You see the ranges are fine. But if you were in the follicular phase and you were showing this number, then we know that there's something out of whack. Same thing for progesterone, same thing for FSH and LH. So know the day in which you collected your blood and mark it. Don't rely on your memory, because two months later, you're not going to remember. It's impossible for you to remember. So get a pen and go in the paper and mark, I collected these bloods on day 21 of my cycle. Okay, it can be a bit trickier, especially if you're having irregular cycles, but it's important to know where you were. In terms of context, fasting and no fasting, it's very important as well. So anytime you're doing lipids, cholesterol, glucose, insulin, make sure that you do it fasting. So whatever you ate the night before or in that morning doesn't have an effect on your blood results. And understand that not always lab optimal ranges are going to feel right. We're going to talk a little bit more about that later. Now, beyond blood work, we also have some other useful investigations depending on your age, depending on your family history. Let's say, for example, mom and grandma and aunties and sister all developed osteoporosis. Oh, hold on, there's a red flag in there. I should be watching for that. Before I develop osteoporosis, I'm gonna go and get a DEXA scan. I'm gonna start watching that trend. So I pick it up early and I do something about it. So it might be interesting for you to get that DEXA scan, to get your calcium score, as I mentioned before, if you have cardiovascular history and high risk, go and get the calcium score. And don't forget the usual that we have to get on top of, especially as we age: mammogram, pap smear, pelvic ultrasounds, gut screen. This is all very important for us to pick up things early. If your gut is not right, check with your doctor if you need any kind of stool testing. Remember that there's some kind of reminding you that there's some kind of tests that you're not going to get through a regular GP. You might be looking to booking in with an integrative doctor or a nutritionist or a naturopath to get access, for example, to a microbiome testing, depending on what's going on in your gut. Now, very important for us to learn how to read between the lines. As I mentioned before, normal ranges are not always normal. To start with, those ranges that we see in the blood tests, you know, the recommendations, let's say, for example, between 10 and 30, they are based on population average. They're not necessarily looking at you as an individual. So that might not be optimal for you. And there is a big issue that is that's very constant in practice that I get all the time: borderline results considered as fine. And I'm going to show you what I mean. Here, for example, if we get those blood results, even ourselves, even, you know, if you never did any kind of studies around health, you can tell there's something wrong, right? Because that number is red. There's a little asterisk in there saying, hey, there's something wrong here. And this is the kind of results, the kind of suboptimal results that is very easy to pick up. And if you are seeing a doctor that is, you know, it's very busy and it's seeing a lot of patients one after the other, you know, that's easy to pick up. The doctor is going to pick that up. Now, there are situations in which we are borderline, meaning that we're just one step away from deficiency. And because this is black, it's not red, it's considered as normal. But that's when you start advocating for yourself. Remember, very important, you start understanding a little bit more. I don't want you to go and get a degree in health just to get around what's happening with you, but there's some basic things that we all should know. I should be taught in school. Every blood test comes with a little interpretation in the bottom. So here, for example, it's telling us that if you are above 50, you're okay. If you are below 50, you're deficient. If you are below 20, you're severely deficient. Now, do you agree with me that 51, it's not good enough? Let's say, for example, you got that 51 just before you go into winter. And you're going to go through 3, 4, 5 months with very little sunshine, with shorter days, or you have an office work, an office job that doesn't allow you to get exposed to much sun. You start very early in the day, and then at night, I don't know, you have another project. Do you agree with me that this is just a recipe for disaster? It's just a matter of time until you fall into deficiency. And why are we going to wait for you to be so run down, for you to be feeling so terrible that when you go to a doctor, you are, oh my God, I'm down to 20. I'm severely deficient because you didn't pick up the borderline 3 months ago. Now, there's a lot of suffering that goes into this. If you are below 20, you are really feeling it. It's not fun. And why would you go through such suffering if you could have picked up early enough? And don't forget that I'm talking about mental health here because vitamin D has a huge effect on how we feel. But this, as we age, is very important for bone health as well. Now, am I going to wait until I'm losing bone mass to act on that vitamin D? Or am I going to wait until I'm getting sick over and over again because vitamin D is very important for our immune system until I start doing something about it? No, we're going to start reading those bloods, even if it was 55, even if it was 60. I don't want you to do supplementation by yourself without talking to a professional, okay? I want you to discuss these numbers. If you get the results in the doctor's practice, doctors say you're okay, you're like, sorry, doctor, I just noticed here that I'm actually very low in vitamin D. Even though I'm within the normal ranges, it's quite low. Can we do something about it? Yeah, same thing here. Look, another example that I had here, ferritin levels. So remember we spoke about iron, transferrin, and ferritin. Transferrin saturation, it's important as well. But here in this example, you might get an okay with this blood result. You might get a, oh no, hold on, everything is fine. Look, your iron is fine because it's spot on in the middle, and your ferritin is fine. Is it though? Because you could be as high as 200 and you don't want to go too high because too much of a good thing is a bad thing, especially high ferritin levels can be telling something not as good about your body as well, but that's another story. We're going to dive deeper into each one of those things as the program goes. But for what we're talking about here, this number, it's not good enough. Your stores are not good enough. If you go through a long period of time without supplementing or without consuming food sources of iron, this storage is gonna go low and then you start really struggling. So I don't want to wait for you to start struggling. I want to start acting straight away, especially if you're losing a lot of blood. This is going to go down in no time. Okay. And another one here that's very typical, fasting glucose normal at 5.4. So note here, so we're talking about those reference ranges again. There's different ranges for random and for fasting. If you are fasting, your glucose levels should be between 3 and 5.4. Ideally, when we see these sort of ranges here, we want to see bang on in the middle. We want to see like around around 4. 4 is a good number. Look, up to 5, it's fine. We start, we continue watching the trend, but we don't need to start being too concerned about it. But when I see a 5.4, which is still normal, I don't want to wait until that number becomes 6. Why are we going to wait until we need medication if we can start acting now? So you see how important this is. Context matters, your age, symptoms, your history, this all changes how we read those numbers. And having a little bit of literacy around the area is going to help you to advocate for yourself and get better results. Okay? Optimal ranges are those ones that are a bit narrower. They are in the middle bit. When we have between this and this, we want to be kind of in the middle. All right. And if we have like on the vitamin D, for example, if it's below 50, well, we don't want to be too close to the 50s. Yeah. All right, the key message here is don't settle for you are in range. Go and read for yourself. Take those results home, take your time to read, and if you have to go back, go back. And if you don't feel right, even being with normal results, you can ask your doctor, is this optimal for me? I understand that I'm within range, but I'm not feeling great. So is this optimal for myself as a person, as an individual? Start those conversations. They are going to guide you, they're going to lead you to better outcomes, to better health. Okay. As I said before, lab results are clues, they're not the full story. We have to understand the root cause of changes that we might see in this pieces of paper. For example, having high cholesterol. Yes, it could be from a poor diet, but maybe you're eating well, but your estrogen levels are going down, and estrogen helps keeping that cholesterol in check. Or your thyroid health, it's not very good, and thyroid is very good clearing cholesterol from our body. So instead of going on statins, which is the medication to lower cholesterol, wouldn't be the case that we should address thyroid or hormonal health first and see if this is going to have a positive effect on your cholesterol without you having to go on meds for it. We have a whole chat on root causes soon, coming up soon. We're going to talk a little bit more about those situations when we have a scenario which is being driven by something else, and then we focus on the something else, because that's when you deal with the root cause of your issue. Okay? If we treat those numbers without context, we most likely be looking at band-aid effect. We're just touching the surface, and we're not actually dealing with the problem itself. Tests are not the whole story. We have to consider symptoms and your lifestyle to better understand them. And that's when, once again, it's very good to have a professional that is there to listen to you and to understand your whole picture. And definitely don't settle just for those surface checks. Remember, the ones that are the tip of the iceberg, they're not going to tell you a full story, and they're not going to be as helpful. Diagnosis is not about chasing numbers. It's not like we just want to see those numbers in check. It's about understanding. It's about empowerment. And once again, it's about getting that roadmap that's going to guide you to the right place. Sadly, there is a lot of cases in which women don't get heard when they are in the doctor's practice. There's a lot of doctors that are still being very dismissive about perimenopause symptoms. So you might hear things like, hey, look, you're just aging. This is part of, being an older woman. And I want to start instigating you to have conversations around this kind of sentences, because this is very disempowering. This is pretty much sending you home to deal with your symptoms. I want you to start feeling a bit more confident in responding. Here, for example, you can say that you understand that age plays a role, but those symptoms are affecting your quality of life. And therefore, you like to explore underlying causes and treatments. You might hear that your results are normal, and you've learned now today. You're never going to take that answer home now. You can respond, can we check beyond the basic screen? For example, I've noticed here that we didn't order ferritin, or we didn't order thyroid antibodies. Can we go a bit deeper? If you hear someone telling you, a doctor saying, hey, let's wait until your period stops and then we can start looking into hormonal therapy. Do we want that? No, you can say, look, waiting until menopause doesn't feel right for me. What can we do to support me right now? You're in the right to ask that. We don't need to create conflict. We're not being disrespectful. We're just standing up for ourselves. We're just looking for a better approach and a better outcome for ourselves. If you hear that you're too young for perimenopause, which is something very common that sadly a lot of women are still hearing from their doctors, you can say perimenopause can start in the mid-30s, and in rare cases even earlier. So can we review my symptoms in that context? There is the typical try losing weight and exercising more, which sometimes is valid, but not always, especially if you haven't done anything to change, if you haven't changed the way you eat or the way you move. You can respond, if that's the case, that you're already focusing on lifestyle. Can we discuss tests or referrals to rule out other issues? Because I'm looking after my body, but my body is not responding the same way as it used to before. And there is that very sad, here's the pill, here's an antidepressant, here's a sleeping tablet, which, don't get me wrong, there might be a place for this kind of treatments in your case, depending on where you are, depending on what you're going through. But most of the times, these are just a band-aid that it's given to us to keep things under control. So if you're not sleeping well, without addressing any possible deficiencies, any possible lifestyle or behavioral issues. If you are depressed because you have a nutritional deficiency, for example, if you're feeling depressed because of that, do you agree that we should look into those issues before we get into an antidepressant? Once again, don't get me wrong, if you are in any of these kind of treatments, or if you're suggested any kind of treatments, there might be a space, there might be a place for them in your life. Especially with the pill, you know your body, you know if you need the pill or not. The reason why I'm bringing this here is because a lot of women are still being offered the pill as a way of shutting down everything. And you know what? Let's just sweep all this mess under the carpet. You take a pill a day and it's all good. And this is not the solution that we're looking for. To that, you can respond, I understand the medication may help, but I would like to understand what's driving my symptoms first. Look at that. This is, once again, you're not being disrespectful. There's no conflict. You're just standing up for yourself. And if it all fails, you can seek a second opinion. You can look for a different GP or a women's health specialist, an integrative doctor. Or you can bring a symptom diary, or you can write down your questions to bring to the doctor. If you feel intimidated and then you forget your questions when you are at the doctor's practice, write them down and bring it to the doctor. Lean on supportive communities. You don't have to go through this alone, and sharing your experience with other women and listening to other women's experience helps you to empower yourself as well. Okay? And never take no for an answer. You deserve a better life. You deserve to feel good. You deserve to age well, so don't take no for an answer. If you come to a diagnosis, if you get a result that is not aligned with what you expected to see, don't panic, don't ignore. Results are just information. They're giving us that roadmap. They're not a life sentence, okay? Use them as that roadmap. Where is your body asking for support? What kind of professional you need to see? What kind of treatment you need to look for right now? Those results are going to be the starting point for building a plan that works for you. If that's the case, discuss with your doctor if you need medication for the short term and what's the long-term plan, what can be done on the long term. If there's any lifestyles or environmental shifts that can be part of the solution, the answer is usually yes. In saying that, you might still have a lot of professionals that don't put that into context, and they'll be like, nah, you know what, just medication. Yes, even if you need to take medication, is there anything that you can do in your lifestyle that could put you in a better position, that could maybe set you up for coming off those medications in the future, or even easing the symptoms alone? Do discuss those things. And if you get into any kind of treatment, track your symptoms, track your results, see if those interventions are actually working. Okay, medications come with side effects, and sometimes they can cause other issues. So it's very important that you understand how your body reacts to any kind of treatment that you might start. And most importantly, use those results to ask better questions and not to hand over the control onto someone else's hand. Okay? Keep those results with you. You're learning about yourself. You're learning about your body. You're taking charge. Things are changing. From now on, you're not that person who hands over control. You take control. You take charge of your health, your well-being. And in saying that, I want you to always keep printed results. You can create a file on your computer and scan it if you prefer, or if you still like having paper around, staple your tests, date them, file them together so we can start watching those trends. We can start working with future comparisons. Okay, if you do your blood tests always in the same lab, they're going to give you the previous results, as I have here in this example. You see 2019, 2020, 2022, but the maximum you're going to get here is 3 of the last results. And if it happens that you do your bloods in another lab, they won't have access to your history. So that's when you have to become responsible for that. Okay, start your little file and start watching those trends. And if it's the case, bring old results to your consultations as well. Reminding you that if you are struggling to get blood tests with your doctor, you can always try another doctor, or you can consider, depending on what it is, to do it privately as well. There's a lot of labs like the iscreen.com.au, for example, which I personally use. I use for myself and for my practice. It's out of pocket. Medicare is not going to cover, but sometimes it's much easier to get that done privately. You don't have to pay for a consultation to do the test. You don't have to do a consultation, pay for a consultation to pick up the results. So sometimes, depending on what you're looking at, it might be worth it. Okay, in a nutshell, let's wrap this up. Blood results help. They won't tell you the whole story. We have to go beyond the superficial tests. We have to go beyond those borderline results as well. If you get dismissed by your doctor, you have every right to ask questions or seek another opinion. And the goal isn't just the normal results. It's the goal here, it's you feeling good about yourself, you feeling better, getting clarity, confidence, and getting that roadmap that we need. Okay, we're going to be soon exploring the root cause of issues that have to be addressed. We're going to talk supplementation as well. There's a lot coming. You know where to find me if you have any questions. I'll see you soon.